سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to IMTV. We're continuing with the program of health and lifestyle. I'm Dr. Hussein. I work as a pediatrician with the MP4 Hospital. This series is just a build-up to some of the children's problems and how we tackle just briefly each and every one of them. We discussed growth and development in the first series. We went through breastfeeding, and we also went through complications and problems with breastfeeding as well as vaccinations. This session, I'm going to discuss something about just some of the common childhood diseases and then discuss one or two of them and build up as we go along. If you have questions, please keep them. You can email us. We'll answer some of those questions in the next sessions as we go along. I'm just going to briefly go through some of the common childhood conditions which we face probably mainly in Kenya for now, common to most developing countries, may be different for some of the developed countries. So in no order of preference, some of them are diarrheal diseases, very common, especially in children below the age of 5 years. We have the pneumonias, which interestingly enough are still killing most of our children below the age of 1 month are dying from pneumonias. We have malaria, still attacking us, still killing our children. HIV and all its complications, very rampant in most developing countries, very significant to most parts of sub-Saharan Africa. TB, still killing many of us. And then malnutrition, many are still dying and then getting HIV, all the other problems combined to it. And something that we often overlook may not necessarily be a disease that causes death, but below the age of 5 years, one of the most common problems that brings children to hospital is the common cold, usually known as the flu in many circumstances. I'll discuss the common cold a little bit further so we can just see what it is, what we can do at home before we come to hospital, and when it becomes necessary to get it looked at by a healthcare provider. The reason why we call it the common cold is just because it's so rampant everywhere. The common cold is usually caused by viruses. There are approximately maybe 100 or so viruses that cause it. All spread simply by contact. So if I'm in a crowded room and somebody sneezes or coughs next to me, I'll pick it up. So consider children who are about 20, 30 children all together, either in a classroom, or they're all in one compound, there are about 5 or 6 children running around playing. One sneezes, one coughs, forgets to wash their hands, so everything is on the hands. They touch another child, they play with another child. The common cold will spread and spread rapidly throughout classrooms. So in other words, in most health centers, it's probably one of the most frequent visits made by parents is the common cold. I'll just look at briefly the signs and symptoms that come with the common cold and some of the just differences between each of them when we compare it to the flu, which is slightly different in category when we compare to the common cold. The most common symptoms are a fever, probably going to about 38, 39, up to 40 degrees in some cases, and a child who now has a running nose or a blocked nose. So they'll come with the nose dripping, they'll come with the nose heavily blocked, breathing from the mouth. They will get a cough. Usually the cough is dry and then gets wet before it clears out. Then some of the other things that might happen is you'll be told, my child keeps on vomiting after coughing. That's also possible. Interestingly enough, for most of the symptoms of the common cold, the fever on average lasts between 3 to 5 days usually. The cough may last between up from 1.5 up to 2.5 weeks is the duration when the cough, the running nose or the blocked nose may last. These are things that vary from child to child. If a child can fight it off faster, they will recover faster. The age groups when it's most common, a child who's just about starting school or preschool, so around 2.5 years, until they spend about 3 to 4 years in school, what we've noted is on average, they will pick up a cough or a cold every single month that they're in school. which means 6 to 8 common colds every year is normal for such a child. When the school holidays are present, they're fine. 1 or 2 weeks after schools open, they pick up a common cold. And then subsequently, roughly every month, they'll have something. So sometimes a parent might even say, but my child is always coughing and running throughout the 3 months they're in school. Very possible. Simply because by the time the 2.5 weeks are ending of a common cold, they've been well barely for another week before they've picked up something else. As children get older and they cross the age bracket of 7, 8 years and above, they usually just get common colds maybe 2 to 3 times a year. They don't fall sick as much. So some of the questions asked are, what are the danger signs when I must come to hospital if my child has a common cold? Some of the things to consider is, if the child has a fever, maybe 39, 40 degrees, but the child still looks comfortable, is not drowsy, is sitting, looking at you, still wants to take a bit of fluid, may reduce the intake of food, but is able to at least take milk, take yogurt, soup, porridge, might take all those things. That's a child whom you can probably keep in the house. If the fever is making the child uncomfortable, give a bit of a fever reliever. So whether you have paracetamol, ibuprofen, any of the products you have in the house, give the child a little bit, bring the fever down so the child is a little bit more comfortable. Then observe the child at home. If that fever stays past 2 or 3 days and is going up instead of coming down, or your child starts to look more and more miserable with the fever, probably time to have your child checked out in hospital. Then parents ask that this cough doesn't seem to go away. What do I do about it? My child is coughing throughout. I need to stop this cough. I need to stop this running nose because my child always has either a handkerchief or a tissue stuck on the nose all the time. What do I do about it? Unfortunately, no matter what medicine we use, most of those medicines do not work. So we prescribe cough syrups, which currently we have evidence that in many children below the age of 5 years, they probably don't have much benefit and they may cause harm. So if they may cause harm, we'd rather not give a child that benefit. Stop using cough syrups, preferably in a child below the age of 5 years. Above 5 years, it now depends on the healthcare provider, but below 5 years, we'd recommend please do not use some of those cough syrups. Then we're in the habit of using a lot of the antihistamine medications, which we, in brackets, called common cold medications, which are sold over the counter in most of the pharmacies and chemists around the country. We need to ask ourselves the question, what benefit does that antihistamine provide as a common cold medication? We now know that a lot of the times for the common cold, it really doesn't help very much, except some of them may make a child drowsy and the child falls asleep. Is it beneficial? Probably not, but they may cause harm in the younger children. So preferably even those so-called common cold medications that have antihistamines, preferably avoid them if you can. They might be used by the ENT doctors a lot more for allergies and that, which yes, they might be useful. Some children have a lot of allergies to dust, to pollen grain, to smoke, and yes, they might have a role. But a lot of children, please avoid as many medications as you can. What might be more useful is the child very often has a heavily blocked nose. There are the normal salt solutions. Any of the saline drops or the saline sprays can be instilled into the nose. They help dissolve a lot of the mucus and get the mucus out, just making it easier for a child to breathe, easier for a child to sleep. In such circumstances, it just means you've made the child's work easier, allowing the child to sleep. That episode of sleeping for 2 to 3 hours continuously is probably what allows the child to repair and heal a lot of those things with the common cold and get better. Then we asked about the cough. What do I do about this cough? My child's always coughing. My child doesn't sleep as well at night because of the cough. Can I stop the cough? Is there anything I can do to reduce the cough? That's probably when the most questions come and the most visits come to hospital, because a child is very uncomfortable with that cough and may not sleep much, and might go back to school, pick a cough, come back, not concentrate in class. What can be done about that cough, which we now know may be beneficial to a child, is use of things like lemon and honey. We have now realized that if a bit of lemon and a bit of honey given, especially the honey, the products in honey, which are usually some of the sugars, may be useful in bringing down that cough, and they just allow a child to settle down a little bit, because all that phlegm which is stuck in the throat which the child cannot cough out may be reduced by the use of honey when we use it. Is it an absolute must that honey must be used every single time? Not necessarily. It may not work for some children, it may work for some, but the current evidence we know is that whether we use medicine or not, the common cold will heal itself in a duration of about 1.5 to 2 weeks. It will tend to sort itself out. There are complications, there are danger signs which we will discuss with you, and when we think that, okay, this might not be a common cold, it might be something else. So what we'll do, we'll take a short break here right now. We'll be back with you after the break, and then we'll discuss some of the problems and complications which may arise when we don't think that we're dealing with a common cold, and when we're dealing with something that we consider more complicated. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back from the break. Before the break, we had been discussing some of the common childhood problems, and we specifically picked on the common cold as one of them and discussed the problems associated with it, some of the medications for it, and what to do when some of the problems arise. I'll just build up and now go to when the danger signs to look out for, and then when it may no longer be just a simple common cold and maybe something else. One of the things children are very good at doing is showing us when they're in trouble. And one of the best ways they do that is either they will completely stop feeding. So you give them a drink, they refuse. You give them any warm food, they refuse to take it. That's an early warning sign that something more complicated than a common cold is going on. They could have a very bad throat, they could have the tonsils infected in that throat, and something is going wrong. The second danger sign to watch out for is if the fevers are not going away. Despite the second, third day of using some of the fever medications, the fever is going up rather than coming down. Time to get concerned that something else is going on with your child. The third time you get worried is if the cough is getting heavier and heavier, a child is breathing faster and faster. So literally when you observe your child sitting, your child is using all these muscles and might be doing that. Time to get worried. Your child needs to be seen as soon as possible. Or on some occasions, what might happen to your child, there's a whistling sound your child produces from the chest. So you might actually hear that. Your child is actually doing that. Time to get concerned. That's about the time when your child needs to be seen again, just because something else is going on apart from the common cold. The fourth danger sign you must watch out for in your child is when your child looks unusually dull, sleeping, does not want to walk, does not want to talk to you for older children. And if it's a child below the age of, say, about 1.5, 3 years, they are consistently sleeping. You cannot wake them up. Time to get worried about such a child. Bring them into hospital. That's about the time when we'll discuss whether now do we have features related to a pneumonia. Now, a pneumonia is a very specific diagnosis separate from the common cold. When your child has a pneumonia, a couple of things you might notice happen to your child when you're at home. Please bring your child to hospital as soon as possible. This is a child who will be using all those muscles to breathe faster. So they start breathing faster and faster and faster. If you bring down the fever, that fast breathing does not stop. Time to get worried. This is a child who now pays no attention to food and is just focusing on breathing. Time to get worried. And this is a child you might even notice that looks sometimes a little bit blue around the lips. Take them to hospital straight away. On arrival, they need to be examined by a healthcare provider and then decide if this is a pneumonia. These are some of the conditions when antibiotics are necessary, or if your child has very bad tonsils, has a very bad throat, may now require antibiotics at that point in time. The difference being the common cold does not kill. Pneumonia can kill your child. We've got to bear in mind that majority of our children dying below the age of 1 year currently in this country, and especially those dying in the newborn period up to the age of about 30 to 60 days after birth, majority of them are still dying from pneumonia. So please, those are the danger signs you watch out for. Fast breathing, child unusually dull and tired, only focusing on their breathing, and completely refusing to eat or drink anything. Go to hospital, do not waste time. And the fever still going higher instead of coming down, your child needs to be looked at. Looking at that, I mentioned something about the common cold versus the flu. When most people talk about the flu, they're talking about that heavy blockage of the nose. Child is literally cannot breathe with the nose because the mouth is doing the breathing for them. They're having a bit of fever, a bit of a cough. The thing with the flu is it's a very distinct difference between the flu and the common cold. What will happen with the flu is there will be very high fevers, probably 39, 40 degrees. Your child will be heavily blocked around the nose, might have red eyes, tearing of the eyes, and will generally also complain of joint pains, tiredness, and they just are generally very miserable. That's a child who probably has the flu. The difference between the flu and the common cold is it's not very often that the common cold goes and causes any problems with the chest and the pneumonia. The flu in children who are weakened for any reason or in elderly people may actually end up going into the chest and giving what we call the pneumonia because of the flu. That is actually quite serious. Watch out for the danger signs again. Fast breathing, persistent fevers, your child needs to be looked at. That's actually important for you to watch out for. Again, we come back to some of the medications used for the pneumonia. All parents complain that my child was given an antibiotic last week. My child didn't get better. Why is my child still coughing? Should I use another antibiotic? I need a blood test to confirm that my child is sick. I need this medications given for my child because the last time I got these medications, my child got better. Please note that each child is unique. That's the reason why sometimes you get antibiotics, sometimes you will not. Even if your child has a bit of a cough, there are times when you might never receive any medications. You might simply get a painkiller and you might simply have to come to hospital. That being said, which children are should you be more careful with, and which children should you be less likely to rush to hospital? A child who's below the age of 1 year, that's a child you're sometimes safer off taking to hospital when they have a fever for 2 or 3 days. They might look comfortable, but if you notice a change in feeding, these are children you take to hospital a lot faster. So and these are the ones who are more likely to succumb to any complications from the common cold, and that's why below 1 year, be a little bit more careful with your children. Between the age of roughly school going, so about 2.5, 3 years to about 5 years, these are children you can safely afford to observe in the house before you rush to hospital. Above 5 years, these are the children who speak for themselves. So they will tell you, my throat is paining, it's getting worse. Use that as a guideline. My chest is hurting when I cough and I'm getting tired when I walk. Those are the children who will guide you themselves whether you need to come to hospital or not. And they're the ones who determine, should I go to hospital, can I wait? So a lot of the times we make a lot of hospital visits with children with a common cold. What we are trying to advise you is that not every single time should a child go to hospital. 2 reasons why. One, it's a lot of time for the parent that you spend coming to hospital. It's a lot of expenses you incur when you come to hospital. Should you be incurring all that, or should we be educating you when to come to hospital? So the difference, what we are trying to do with this program is educate you, give you that power to decide, should I come to hospital? Should I delay going to hospital? Those are some of the just basic guidelines that we'd like to give you as we go through the program. There's another thing about TB which is now related to some of these coughs. People ask, when should I worry that my child might have TB when I'm discussing the cough, the fevers and all that? For most children, we start worrying about TB, especially for many of the developing countries, Kenya being one of them. We have a very high burden of adults who are walking around with TB. These are the people who are likely to infect our children as they cough near our children. The dangers, the warning signs when TB must be looked out for. If there's any adult in your family who's been having a very prolonged cough and who's lost some weight, that's an adult who should be taken for TB screening. If they're found to have TB, please now get your children screened as well. The symptoms in children are not as clear as for adults, but some of the warning signs that TB may be present. A cough exceeding 3 to 4 weeks continuously, getting worse. A child coughing any time of the day, not specifically night or morning. That's a sign that once you're exceeding 3 to 4 weeks, your child needs to be evaluated for possibility of TB. A child who's either not gaining any weight at all or a child who's losing weight. So this is a child who initially was maybe 3 years old, weighing 18 kilos. After about a month of coughing, the child now weighs 13, 14 kilos. Time to get concerned about TB. The other thing your child might do when they have TB is they're persistently weak and tired. They have no energy for anything. Throughout that period of 1 month, they don't want to play. When they play, they come back always tired. They come back always coughing. Time to get concerned. Another time you get concerned is, this is a child who will have fevers. The fevers may not be always 39, 40 degrees. Fever comes in the morning, tends to disappear. Child is still coughing. Fever comes back in the evening, disappears the following day. You go to hospital, you're told, yes, maybe this is a pneumonia. You're given an antibiotic. You use the antibiotic for the 5-7 day duration you're given. Cough still continues. Your child is still having fevers after that. This is about the time when you've got to start considering you need to see a healthcare provider who will then evaluate the full TB workup and go through step by step trying to decide, does your child have TB? So it's usually, if your child is losing weight, time to get worried. Your child has a cough more than 3 to 4 weeks consistently, never seems to go away. There is an adult in the family who may have been diagnosed to have TB or who's had a prolonged cough for more than a month and is also losing weight. And the fourth time to get worried is that when your child now starts to look unusually and dull throughout this period. Just to help us summarize what we've looked at in this session, I've looked at some of the common childhood infections, focus on the common cold, when to get worried and when to seek health care, when to worry whether this could be a pneumonia and you need further assistance, and if possible, what might be some of the warning signs that is this something and it could be TB, which we need to watch out for in some of our children simply because the symptoms are vague. If you have any questions, please feel free to contact us. In subsequent shows, we'll go on answering the questions that you give us, and that will act as our guideline on how to answer some of the problems that you may face. Assalamu alaikum wa rahmatullahi wa barakatuh.